Hi, everybody. I'm Dr. Jennifer Ashton with ABC News, and I am so excited today to be speaking to Dr. Wanda Barfield. She is the director of the CDC's Division for Reproductive Health. And we are talking about the brand new CDC campaign called Hear Her. And before we get to that campaign, Dr. Barfield, you and I have so much in common professionally, but I always like to find out a little bit about, or a lot about, someone's background and how it got you to this point, both professionally and personally. So tell us a little bit about your career with the CDC and how you became so passionate in this topic.
Yes, so I actually have had a passion for the care of newborns in newborn medicine when I started college, and interestingly enough noted that there were disparities in the birth of Black infants compared to white infants, and that was really a passion for me. But as I continued my career, I really realized that, the health of infants really depend on the health of their mother in so many ways. And at CDC, I had an opportunity to join what was called the Epidemic Intelligence Service after spending several years in the US Army as a neonatologist as well. And coming to CDC, I really had this wonderful opportunity to really think about population health and the population of mothers and infants. And in our division, we do a lot of work focusing on those issues, on reproductive health, on maternal health and infant health, and they're so interconnected. So this has been a passion for me in particular and for the team that's represented in our division and at CDC. It's really a priority.
So for people who may not be aware of this, they need to be aware of it. Everyone needs to be aware of it. We are in the middle of multiple crises in public health, as people know, but one of them in particular has to do with our increasing and concerning rates of maternal mortality that we've seen in this country over the last 2 decades, and in particular, the disproportionate risk of death and poor perinatal outcomes faced by women of color, particularly African-American women. So give some context to that for the viewers, if you can, because there are some people who said that it was a data collection issue. There are other people who say that it's they kind of do what you and I don't like to do in medicine, which is they blame the patient, saying women are sicker, they're older, they're more high risk. Explain kind of the evolution of that, particularly how you and your team at the CDC have been tracking those statistics, and what you think are the important factors that have contributed to this increase in death amongst women at a time in their life where obviously they shouldn't be dying.
Yes, I think it's really important to note that despite all our technology, despite all the resources that we have in the United States, we really haven't been able to reduce maternal mortality. And in fact, it's been a persistent problem. And in some instances appears that it's just not improving, especially when you compare ourselves to other developed countries. And our team has been doing a lot of work to better understand maternal mortality, or more specifically, pregnancy-related mortality, through working with states on maternal mortality review committees. And although that work is going on and it's very important and data has become more and more rapid, what we also understand is that it's really important to get the message out, that women are able to actually have an opportunity to be heard about these concerns. Because as you know, Dr. Ashton, time and time again, we're hearing about these stories of women who know that something just isn't right, and yet they're not being heard. And so we felt that in addition to the work that we're doing in terms of better data and really trying to understand the underlying causes, we really need to get the messages out, particularly about some of the critical warning signs.
So let's talk about some of the numbers before we get into some of the hopeful solutions that Hear Her campaign may bring to light, particularly risk of death. There are about 700 women who die in the United States every year just in the course of being pregnant and delivering and in the postpartum period. There are tens of thousands of near misses, right?
Yes.
You know, that could also be deaths. And we put the most accurate CDC numbers to our death rate in the world so that people can understand just how poorly we're doing.
So in the United States, each year about 700 women die due to a pregnancy-related cause. And unfortunately, you know, what's so tragic about this is about 2/3 of these deaths are preventable. And you mentioned the issue of near miss. Well, about 50,000 women die, well, not die, sorry, but are having an experience of near death in the United States. So we're seeing 50,000 women each year in the United States who have severe maternal morbidity.
We heard in the last, I guess it's over a year now, time's
Yes.
flying, but Serena Williams went public with her story of her pulmonary embolus during pregnancy and during her delivery, and how she had a history, she knew something was wrong, and even she experienced what she perceived as difficulty being heard. It doesn't take someone with a lot of initials after their name to say, wow, if Serena Williams had trouble having people hear her, what is the average everyday woman who may be a woman of color, what is their hope? So that kind of dovetails into your campaign. So first of all, what went through your mind as a woman doctor, as a woman of color, as a specialist in this field when you heard her story?
So I think that it's important for us to understand, and we've known this unfortunately for a while, that despite education or economic status for Black and Native American women, their risk for pregnancy-related mortality is 2 to 3 times higher than that of their white counterparts. And despite the education, we know that there are factors that are in play that aren't really allowing women to be heard. And that's part of the reason for this campaign, that we really need to all play an important role in making sure that the voices of women are heard, whether that's women themselves, those who are around her, who really care for her, our colleagues in terms of the medical profession, our communities. We all have an important role to play.
So explain, you know, let's do a deep dive on the Hear Her campaign.
Yes.
What do you, I know that obviously the major objective is that it will empower women and those around them to speak up when they feel something is wrong. Specifically though, what are your hopes of how this campaign will help have a positive impact on women's health and save lives?
So we really hope that we're going to have a positive impact through several factors. One, giving an opportunity to really increase awareness of serious pregnancy-related complications and their warning signs. I mean, so many of us know someone who's pregnant, know someone who's been pregnant, and also know someone who may be planning to become pregnant. It's really important to understand, as you know, that pregnancy-related complications don't just happen during pregnancy. You know, a third can happen earlier in pregnancy, a third around delivery, and a third about a week to up to a year after the delivery of a baby. So it's important to have that awareness even when a woman isn't obviously showing that she's pregnant.
So how will the campaign actually be implemented? Do you foresee that it infiltrates midwives and obstetricians' visits? Will there be a hospital or a clinic arm? You know, talk a little bit about the nuts and bolts of the campaign, if you can.
So we imagine that there's opportunities to communicate this through many different venues. So whether that's social media and the opportunity to really communicate, to share information with friends and family that you know, to have information available in providers' offices, to have information available even in the places and communities where women are gathering. So We see the opportunity for billboards and communication opportunities that reach far and wide. And we're really excited about this. This is something that needs to be disseminated nationally.
Dr. Barfield, you as a pediatrician, double board certified, I might add, pediatrician and neonatology, your patient is obviously the newborn. You have an eye on that in utero as the fetus. My patient is the pregnant woman. Together, we're managing and dealing with multiple lives at the same time, at least during pregnancy and delivery. It's been said in the field of OBGYN, and in particular ACOG, that in this country, we have made incredible strides in your specialties. And I see you shaking your head. I'm sure you've heard this many, many times. When I was an intern in the year 2000, a baby born at 24 weeks of gestation, pregnancy, had a 50% chance of survival. And of those who did survive, 50% had severe long-term neurologic impairment. Your specialty of neonatology has really busted that wide open and have made incredible strides in taking care of the most premature, the most vulnerable newborns and neonates. At the same time, as you know, we've kind of gone the opposite direction in taking care of my side of the patient combo. Why do you think that is? Why do you think in this country we tend to put all the focus on the pregnant woman until she's no longer pregnant, and then we switch to just focusing on the baby?
You know, I think that we really have an opportunity to think sort of ahead, right? I mean, if we could, so I'm often at a delivery because there's a complication, and often because there's a baby arriving earlier than expected. And we really do need to think about what we can do upstream to really not only help that baby, but to make sure that that mother is as healthy as possible. And so what we can now do is really focus on women. And that's what this campaign is about. It's an opportunity to focus on a woman's health. And ideally, we should be thinking about women's health even before they become pregnant. But we really need to sort of get the information out and think about how we can care for women who are our sisters, our daughters, our aunts, but not only to see them, but to see other women in that way. I mean, we really have to think about how we need to put more energy toward women, and particularly pregnant women, as well as postpartum women. So not babies, but we want them to go home with a healthy mother.
For sure. Let's take it, if you will, segment by segment of that timeline that you referenced before. The prenatal issues, the intrapartum issues, or those that occur during labor and delivery, and then the postpartum issues. Where do you see, I mean, first, when you think of those three timelines or categories of time, in particular, how he or her might be able to intervene, if you had to rank them for you, what's at the top of the list?
Well, I think that all of the areas are really important because every woman is different, and the experience of a pregnancy-related complication or a severe warning sign may really vary for individual women. But I think one aspect of this campaign that is particularly important is for many of us to understand that pregnancy complications occur after pregnancy. And it's an important piece of information, as women say, are seen by their doctors, or maybe having an unanticipated health visit, say, for example, in an emergency room, that knowing that she recently had an infant is an important part of her medical history. And there are activities, as you know, that are different depending on that different stage. So for a woman who is currently pregnant, those lists of complications may be different than a woman who's delivered.
And then when you look at the causes, the top causes in this country of maternal mortality, cardiovascular disease or cardiovascular events, important distinction, are at the top of the list. And not far behind are psychiatric issues, suicide, overdose, and other psychiatric kind of events. Can you address each one of these, and again, where you think the opportunities for intervention and improvement rest?
Yes, so you bring up an important point about heart disease and cardiomyopathy, a condition in which the heart muscles are weakened. And we do have an opportunity to think about that, not only in the postpartum period, but thinking about a woman's health even long after pregnancy. We know that women who have pregnancy-associated hypertension are at increased risk of cardiovascular disease. With regard to the issues of mental health, that's an issue that's important, very important. And we've recently used a system called the Pregnancy Risk Assessment Monitoring System to look at the risk of postpartum depression. And it's really an important issue. And what we found was that many health providers are not speaking with women about mental health issues. And that's not just the obstetrician. Pediatricians and other primary care providers have an opportunity in their health encounters to talk to women about their mental health. And there are several mental health screening tools that are available.
What about, Dr. Barfield, the criticism that the CDC has taken with respect to the way it tracks data, in particular pregnancy-related mortality? As with many things in medicine and science and public health, things are rarely as simple as the headline. But people heard everything from death certificates weren't standardized to include pregnancy as an additional category, or things weren't computerized. Can you just break it down, since this is actually what your division does, kind of explain to us the truth of what went on, what is going on, where you think there were kind of not mistakes made, but things that could have been done differently, and how things are being done differently now by the CDC?
So I think that it's important to note that a pregnancy-related death is a complex problem that may culminate into the event of passing. It isn't a single test or a single pathognomonic sign that may indicate that someone's died. I sort of think of it akin to the way of sort of CSI, right? There's an investigation that needs to be done. There's information that needs to be uncovered. You have someone who has unfortunately had an untimely death, but the factors that contributed to that death may not be directly evident. And that's where the opportunity to work with a maternal mortality review committee at the state level is the opportunity for us to really understand the circumstances underlying a death. So I'll give you a specific example. It may be, for example, that a woman may have died from a drug overdose, but the question is, well, what was that intent? Perhaps it was in the postpartum period that there was a difference in her weight, and maybe that was an accidental overdose. So trying to gather this information from the community, from hospitals, from also visits where there could have been a missed opportunity for a woman to be seen is an important piece of information that needs to be shared. I think with regard to the recording of data, we work very closely with the National Center for Health Statistics in reporting maternal mortality. And that's one component that's very important in terms of understanding pregnancy-related deaths. And in the past, there's been a pregnancy checkbox. It may be that that information may not be as accurate. And so now there have been efforts to really try to improve the accuracy of the checkbox.
And Dr. Barfield, since the CDC obviously is global, even though obviously it's a US division, you know, you have your eyes on reproductive health worldwide, not just here in the United States. What parts of the world do you think are doing this well, and what parts of the world do you think are in worse shape than we are and need some more attention and more assistance?
Well, many developed countries are doing a good job in terms of reducing pregnancy-related deaths. But, you know, there is promise in some areas of the developing world to include sub-Saharan Africa. More recently, the US government effort on Saving Mothers Giving Life was an opportunity to see a proof of concept in terms of the reduction of pregnancy-related deaths. And a lot of that had to do with getting women access to facilities so that they could get appropriate emergency obstetrical care. So there is promise, and I think thinking about the systems that can help to improve maternal health and access to care is really important.
And I really couldn't have this discussion with you at this time in the midst of the largest global health emergency that certainly has occurred in our lifetimes and our careers, without asking you specifically, how do you think that the coronavirus pandemic, both here in the United States and across the world, is affecting reproductive health? It was described, I'm sure you saw the commentary in the Lancet in just the last week, as devastating to the health of girls and women around the world. Talk to us a little bit about that and what your concerns are and what kind of things you're watching for.
So there are many concerns with regard to SARS-CoV-2 and COVID-19. And I think for women who are either contemplating conceiving, those who are pregnant, and those who are postpartum, there's increasing concerns. But what we do know, and part of the reason why we decided to go forward with this campaign, even in the context of a pandemic, is that we want women to still be aware of potential warning signs related to pregnancy, and that they are able to seek the care that they need.
And not relating to pregnancy, but birth control, contraceptive services, possible increase in sexual and domestic violence. How do you feel the pandemic is impacting those issues, both here in the United States and worldwide for women?
We're still trying to understand the effects of COVID-19 on various reproductive health outcomes. But I think that we're also trying to think about what are those potential solutions. For example, how does telemedicine play a role in terms of giving women access, for example, to contraceptive health services? How can we also utilize networks to make sure that women are getting the care that they really need?
Well, Dr. Barfield, is there anything about Hear Her that I didn't ask you that you really want viewers to know? It's such an important campaign, not just now during the pandemic, but always in the field of women's health and reproductive health. What do you really want to leave people with?
We see that Hear Her is a fast campaign and a real opportunity for us to support pregnant and postpartum women by getting the opportunity for them to be appropriately heard.
So important. Dr. Wanda Barfield, you're the CDC Director for Reproductive Health. I want to thank you not only for this campaign and for your public health service in your 20 years, is it, at the CDC?
Yes.
But also for your military service. Thank you for all of that and for taking the time to speak with us today, and anything that I can ever do to help you on this mission as an OBGYN to a neonatologist, call me. I'm always there. I'm always here.
Thank you so much, Dr. Ashton. It's been a real pleasure speaking with you today.
Thank you. Be well.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.